Welcome back to the Baby Sleep Connection podcast. I'm your host, Heather Boyd, and I am excited about this interview for this episode. I am interviewing integrative physician Dr. Joel Gator Warsh. He and I had a conversation that covered the gamut. Now, I imagine that knowing that this interview is with a pediatrician, you'd be expecting it to cover a lot of things like the symptoms that would bring you in to see a pediatrician. But the emphasis is going to be on the integrative part of his pediatric practice. We cover a lot around parenting, and what comes out for me as something really significant as you jump in to listen to this episode is his real understanding as a pediatrician and a dad of how hard those first 3 years are for parents. The empathy is clear. His perspectives on how to manage the first 3 years with less worry, less anxiety, more knowledge really comes through crystal clear. We cover everything from the foundations of raising healthy kids during what seems like an epidemic in chronic illness for kids. We talk about that pressure to be perfect and the Instagram images that lead us to feel really inadequate as parents. He talks about milestones and the CDC milestones and guidelines and how to use them to support your parenting instead of undermine them. Dr. Warsh also shares his key steps that he recommends for supporting and making the biggest difference in your kids' health. But we also dig into some other things that may be playing on your mind as you navigate parenting, like baby-led weaning versus purees, and breastfeeding versus formula, and most importantly, how to be flexible with your parenting expectations. Have a listen. If you like the episode, follow this podcast and drop me a line at heather@heatherboyd.ca. I would love to hear what you thought of this episode. So here we go. Enjoy this episode. Welcome to the Baby Sleep Connection, a podcast that explores baby sleep and more through the lens of attachment and development. I'm your host, Heather Boyd. I'm a mom of 3, an occupational therapist, and a certified infant and family sleep specialist. If you are a tired parent who wants to support your baby's sleep holistically, keep listening as we delve into approaches that go well beyond the usual strategies of wake windows and bedtime routines. Your baby's sleep is connected with so much more. Hey, welcome back to the Baby Sleep Connection podcast. I'm your host, Heather Boyd, and I am so pleased today to be able to interview Dr. Joel Warsh, better known to me as Dr. Gator online. He is an integrative physician, popular parenting Instagram personality / pediatrician from Los Angeles, California. He specializes in parenting, wellness, and integrative medicine. He's the author of Parenting at Your Child's Pace, an integrative physician's guide to the first 3 years that is coming out in August. He grew up close to where I am here in Niagara. He grew up in Toronto, Canada, had his master's degree in epidemiology from Queen's University here in Ontario before earning his medical degree from Thomas Jefferson Medical College. He completed his pediatric medicine training at Children's Hospital of Los Angeles and then worked in Beverly Hills in a private clinic before founding his own current practice in Studio City, California. He's published research in peer-reviewed journals on topics covering a wide variety, from childhood injuries to obesity and physical activity, and he's been featured in a number of podcasts. It gives me great pleasure that he is now being featured on the Baby Sleep Connection podcast. Thank you so much for being here.
Thanks for having me on. I'm excited to chat again.
Yeah, this will be wonderful. I will add as a side note that I do know Dr. Gator because he was one of the instructors in my sleep certification course. So it's nice to get to see you again. So I want to start for those parents that may not be familiar with what integrative medicine is. What does that mean and how does that play out as a pediatrician in your practice?
To me, it means blending the best of modern Western medicine with alternative and holistic practices. And so there are so many opportunities outside of modern medicine to really bring together the best of, supplements, herbs, other modalities that are used all around the world and bring that into medicine and maybe not jump to a medication right away. There are a lot of times where a medicine can be helpful, and I'm not against using medicine at all. I'm not against Western medicine at all, but we overuse medicine way too much these days. And I feel like there is a great opportunity to blend the best of both worlds together and try some of these modalities first, especially when it's safe and reasonable. And so that to me is what integrative medicine is. We just try to blend the best of both worlds together on any given day for whatever makes sense for that child.
Lovely. And when it comes to my work, I'm taking a very holistic approach. So that integrative idea of looking at things more broadly really resonates for me. And I'm sure it resonates for a lot of the parents listening too. Now, I, of course, am looking through a lens of sleep. And I am curious because this comes up often when parents are talking with their physicians or pediatricians about sleep. What kind of training do doctors typically get around baby sleep? And how have you incorporated that and added to that in terms of the support that you give to families in your practice?
Yeah, we don't get a lot of training in sleep. We don't get a lot of training really in any of the preventative topics like diet and nutrition and exercise. I mean, certainly we talk about it a little bit, but it's not a huge, major part of our training. You know, when you're in medicine, you're learning a lot about identifying serious diseases and how to figure out if it's something you need to send to the hospital versus not, or taking care of them in the hospital. But you don't get a lot of training in what I would say are basic foundational parenting things like sleep. And that's even one of the reasons why I wanted to write my book in general, because the reality is that so much of pediatrics, especially in the clinic, is not really medicine, I would say, per se. It's more parenting. I mean, there's such an overlap between those two, but a lot of the questions we get in the office are really parenting questions, I would say, sleep and toilet training and tantrums and behavior and development, as opposed to coughs and colds and runny noses, which obviously we get too. So I don't think we get a ton of training in sleep, but it's so important and so foundational. And that even is one of my, big foundations of health in general is sleep, when I talk about what are the things that we're really overlooking. So yeah, I think it is really important. And I have definitely spent more time learning about it and even just gaining an appreciation for how important it really is.
Well, and I think when you talk about just how many areas that you can cover holistically, sleep being one of the foundations, what else are we missing when we're looking at raising healthy children?
Yeah, so I call it the seeds of health. And if you, in my book, when I start with the first chapter, I really wanted to focus on those foundations and the things that we can actually do to make a difference. And so I call it the Dr. Gator smoothie, kind of a play on smoothies. And if you watch a daytime TV show, there's always some air quotes guru on there saying, oh, if you put this and this and this together, it'll cure all your diseases, which is not true. There's no such thing, right? We have to focus on our foundations, and that's where we really gain the resilience and build a healthy foundation. So I start with a big scoop of the seeds, which is stress, environment and toxins, exercise, diet, and sleep. And then you can also mix in nature, encouraging home, mental health, vitamin D, love, family, all these things that we know are really important to our health, but we often just don't focus on that, and we focus on what medication we can take, or not about sleep, which is so foundational when we realize that we rest and we digest. That's where we're doing most of our growing. That's where our immune system works, and it's at its highest level. So I think that we don't give enough appreciation to our sleep, and certainly in the teen years and as we get older, it tends to drop off, and it's not something that a lot of families are focused on, but it is very important. I mean, especially these days when we're in the middle of a mental health crisis and we're also seeing more and more chronic disease. So something fairly simple to tweak is sleep, and making sure that we're getting optimal sleep and making sure that our sleep environment is optimal to promote even a little more sleep can be helpful.
Well, and what stood out for me, or one of the things that stood out for me in your book, is the focus on appreciating what the reality is around sleep for parenting in the first little bit of parenting. I wonder if you can speak to that reality of expectations versus what really does happen when we bring babies home from the hospital.
Yeah, I think it is very important to remember that if you are just comparing yourself to what you see online in social media, or like social media, the news, then that might not be the exact standard that is the reality of what it's going to be. So I think it is really important to remember that if we want to have a general understanding of how things are going to be, speaking to family can be really helpful because they've been through it. Reading good books could be really helpful, but just comparing yourself to what you see on social media often is is not a good marker because people portray things in a non-realistic light. And a good example of that for me is the 1 month visit, where oftentimes parents are not at their best. I take care of some fairly prominent individuals, and what you could see at times is they'll come in, they might not be at their very best state, but then you'll look on social media and they'll show the perfect nursery. They're taking a family photo that's curated, and I just saw them 10 minutes ago, and it's like, you were crying in my office, but they're not always portraying the reality of what the situation is. So if we compare ourselves to what we see on social media, sometimes that just is not great for our mental health and not really how it is for most people. So I think it's important not to compare, but to just have a realistic expectations of the ups and downs for parenthood.
Yeah, I feel like with the social media thing, there's almost a tyranny of getting it right or getting it perfect. Mm-hmm. And that can put so much pressure on parents who are trying to do it the right way, as if there is only one right way. And that's another thing that stood out with your book. I found that every issue, and you certainly didn't avoid some of the real hot button topics in parenting, the things that are really a buzz in terms of, baby-led weaning versus purees or bedding in the hospital. You didn't steer away from any of it, but all of it was approached with such care and understanding that every family really needs to make the best choices that they can make for their particular family with the best evidence that we have. And when I hear you talk, I can picture you in an office with a family, really peeling back the layers of what it is that they're worried about. I think a lot about the level of fear that parents have about getting it right and the level of fear around their babies getting sick. And I wonder if you have any perspectives on how families can use social media or even Dr. Google in a way that doesn't accentuate their fear.
Yeah, that's a great question. So it is very easy to go down a spiral and to be very nervous about anything that you Google, anything that you look at. But the reality and the thing that I tried to impart in the book is just to remember that most things that we're worried about are normal. Out of the 100 texts that I get on any given day or week, 99.9% of them are all normal. And so that just leads me to remind parents that it's okay, of course, if you're worried about something, to call or to get checked. And certainly if you're very worried, go get seen. But in general, most things that parents worry about are normal. And so using Google can be helpful, and I don't discourage people from doing it, but I think you just need to be mindful of the way that things are curated these days. And the way that they're curated is around liability, right? So we see, you read an article and they're going to talk about all the worst things that could possibly happen from a symptom. But when you're talking to a doctor who has been through the training, the doctor is not looking at the one symptom, they're looking at the picture, the whole picture for that child. And that's what's important to do as a parent. And you may or may not be quite familiar with all the things to be looking at. And that's what, you go to the doctor for, to have that discussion. But just because you have some gas or bloating doesn't mean you have the scary gut disorder that you're worried about. If you Google that, then any minor symptom or any symptom in general that's related to that is going to be showing up in that list. And you can say, oh, well, there's some gas. Well, now I'm worried about Crohn's, right? But the thing that we're missing from that is the rest of the picture of, are they growing okay? Is there blood in the poops? All these things are the other questions that we would ask to get a picture, to be more concerned with that versus just a regular baby gas. Or developmental milestones, very similar. Just because you're a little bit delayed on one milestone, like walking or talking, doesn't mean that there's an issue. But where we would be more concerned is if there are multiple milestones that we're late on, there are other things going on, the kid's sick all the time. So these are the things that we kind of put in context. And so I think it's important as a parent, again, going back to that, where if you are going to Google, if you are going to look into these things, then just to be mindful of, oftentimes when you're reading things, you're going to see the worst aspects, or somebody's trying to sell you something. And we just need to be aware of that and put it in that kind of context while we're searching. So not to stop you from searching, but to just be mindful that that's what you might be reading. So hopefully it decreases your stress a little bit.
Wonderful. You mentioned milestones, and I'm curious around the new guidelines that CDC put out around the cutoffs for when to worry and when not to worry about milestones. I'd love you to share your perspective on that.
Yeah, so the new milestones definitely created some controversy, because I think a lot of people didn't exactly understand what occurred. And really what they were trying to do was to figure out when you should be worried, as opposed to what is the median or the middle number for a certain age. And so things got moved back because it was more in line with when we should be worried about something. Like if you're not walking or talking by 18 months, then we should be more worried. So I think that was a little bit of the controversy around it, because a lot of people said they were moving it back because we're not doing as well, which is not exactly the reasoning behind it. So I think that there, could be some concerns around moving some of that stuff back, but the reality is that it was more just for trying to catch things earlier, trying to catch issues. And that's really what the developmental milestones are for. They were never really meant before to be an exact age where your child does something. It's more a marker post for you. And I think that's what's important about the milestones. And that's what I try to help parents take away from it. Like in the book, I don't run through all of the different milestones and when they should be. We just talk about milestones, what they mean, and how you should think about them. And to me, the way you think about milestones is to give yourself a marker in general of where other kids are, because I think that's useful to know. It's useful to know that the average kid walks at 1. And so if your kid is 2, that's less normal. But it doesn't mean that just because your kid is 13 months that you should be worried, because that means that half the kids after 12 months are still not walking. So that's not abnormal. There's a wide range of what is normal. And I think it's important to put that in perspective. And especially in today's culture where we're comparing ourselves, and you see, oh, your friend's kid or some celebrity's kid is walking at 10 months, but they're also not showing that they haven't spoken until 14 months. So you usually only see the positives and not always the negatives or the things that are, I wouldn't say delayed, but just not ahead. People are showing things at their best. And so that is where I think it's really important for, again, parents to not compare themselves to others too much, to have a general understanding of where things are, but then not to stress out too much if your child isn't doing something exactly when the textbook says, and especially if it's a very specific skill. This is always a funny one to me, like, stacking blocks, and you might have a child you look at the textbook and it says, oh, they should be able to stack 12 blocks by now, and the parent's like, oh, well, I don't think they can do that. And I'm like, well, did you ever try? Have you ever practiced? Because some of the skills also involve actually doing it and learning, and just because a kid can't stack 12 blocks, maybe they haven't really practiced doing it, and if you give it to them 10 times, they would. So some of those skills also involve a little bit of actually doing it a few times.
Wonderful. Well, and I do recall the explosion on social media among therapists and physicians around the guidelines, and I'll have to look back at what I posted, but I think it generally parallels what you said. But when I looked at it, I thought, this actually is just a different way of looking at the same kind of marker. When should we be concerned versus what's typical? Now, you have the distinct advantage or perspective, I suppose, of having both lived in Ontario, so being part of the Canadian healthcare system and the American healthcare system. And not that we'll delve into healthcare systems and policy, but I wonder, when you look at the healthcare system as a whole, Canadian or American, what is it that's working well with it for families? And what's one thing that you feel could really shift to support young families better?
Yeah, I don't know. I don't know that the healthcare system in general is working super well for most people. I think if anything that's really improved over the years, it's like emergency care. So I think that's been very useful and helpful, and emergency care is fairly excellent in general. But I think that the general system is not great for a lot of the problems that we have today of chronic disease. And so that's something that I really think we need to focus on and improve over the next few years and decades, is really getting back to the basics and spending more time on the foundations and spending more time discussing things with patients, or maybe working in teams a little bit more to spend more time with patients. Because as of right now, whether it's America or Canada, there's more and more wait times. It's harder to get in. You're spending less and less time with your doctor. And that's very difficult for doctors to spend a long time on these things if they only have a couple of minutes with you. And it's difficult if you can't see your own doctor, which seems to be more and more the case in both. So I think it's spiraling in a not great direction based on pharmaceutical companies, money, corporations. And I think we have to move away from that again and figure out new solutions for modern problems. But medicine's very slow to change.
So because of that, because medicine itself is slow to change, for the families that I'm thinking about who are already holistic minded, and even if the word integrative medicine is new to them, they're more aligned in looking at what they can do to optimize health and to reduce the risk that their child will develop a chronic illness at a time when it's an epidemic of chronic illness at this point in pediatrics. For a family who is interested in taking a more integrative approach, regardless of whether they have good access to their physician and whether or not their physician thinks integratively or not, what would some key areas to focus on? I mean, you've gone through the seeds, but if you think about a tired family that is looking for a way to leverage a little bit more support or a little bit more knowledge or a little bit more action on supporting their baby's overall health, where would you suggest they start putting their attention?
Yeah, I would say the two big areas where you get the most bang for your buck is food and toxins. And so if we're going to do one thing, I think it's reading labels. I think that's a very easy thing to start with, and it can make a huge difference in the long run. You don't have to have a PhD in chemistry to know all the ingredients, but you can certainly turn over the label, look and see what's on there, look at the sugar content, see if there are a bunch of words that you don't even know what they are. If you don't know what the words are, it's probably not good for you. And you start being a more mindful consumer, and you start purchasing items that have better ingredient lists and more simple ingredient lists, and that gets you a long way. So I think if you just start there, whether that's food or cosmetics or really anything that you're buying, if you just start reading labels, then those small little changes add up. It doesn't mean you have to go from chips to broccoli, but you can look at 2 bags of chips and you can buy the one with better ingredients, and that can give a little bit of a benefit for your kid, and that adds up. If you do that with every single purchase and every single food for the next 10 years, then those things really add up. And on top of that, I think we have to become more mindful of convenience, and convenience can be good, but what do we lose with convenience oftentimes is health, especially when it comes to food. And so we have to just remember that we understand that things sometimes can cost more and can take longer, but at the same time, our health is really important. And so we have to try to fit in cooking more, as much as we can, try to spend more family time, get the kids involved. But realistically, it's knowing the ingredients that are in your food, and the more that we can cook, the better. So that might mean one more meal cooking a week or whatever it means for your family. But the reality is our health is not great, and it's going in a worse direction. And so we have to find small ways for our own family to make a difference. And I think that is the first place to start, because you ask almost any integrative practitioner, and our food is one of the biggest issues that we have. And so if we start adjusting that a little bit for our own family, then that will go a long way.
Really appreciate what you've said about the small steps, because I think of how overwhelming the first 3 years are for parents and how exhausted and worried they are that this idea of not having to go 0 to 60, that they can just make one incremental change, adapt to that new change, and then move to the next step. And to look at it in such a long picture as 10 years makes you realize just how things can accumulate in a good direction, a positive direction for health, and also in the other direction. But the flip side to that coin of trying to prevent and preventative medicine is the level of fear that parents are carrying around right now. Part of that is the social media aspect of it. Part of it is just the intense pressure I think parents are putting on themselves to get this right. What are your thoughts on managing the news fear-mongering, or being able to filter out the bad information from the information that can actually support families?
Yeah, it's a tough one. I think that's a great question. Number one, there is no right. There's not an exact right. There's no perfect way to parent. It's really a continual cycle with your own child of seeing what works for them and then trying to do what is best for them based on what you know and what you see and what you learn. And so we don't want to have parents feel more stress or more shame if you see some article that says, oh, this thing has arsenic in it or lead, and that was from before, and oh, my kids ate that. Okay, well, fine. Now we don't buy it anymore. You can't change the past, but we just keep learning more and making changes and moving forward, because our bodies are resilient and they can handle a lot. And so what we want to make sure that we're doing is, as we're moving forward over the long run, we continue to make those small changes, continue to learn, and continue to make adjustments as we see them. And so with social media, with the news, again, you have to be mindful that that's what they're doing. They're trying to catch your attention. They're trying to tap into that fear. They're trying to tap into that division because that's what sells and that's what works. But you can curate your feed a little bit more if you want to. I think that's not unreasonable to get rid of some of the fear-mongering accounts and put in more, puppies and whatever else makes you happy, architecture, travel, whatever it is that you can do. You can follow more of those accounts, so it kind of drowns out some of the fear. And then, spend the time to try to start learning some of these things if you can. But even if not, then again, just small steps, small changes, and all of those things matter. It adds up. And that's what I want to see people do. It's not to get stressed out about this, but just to be mindful of their health and know that we have been marketed to for so long and that we have moved in somewhat of a worse direction. And now we need to kind of bring it back and balance it, because many years ago, people were dying when they were 40, right? So we come a long way in terms of generalized medicine and treating infections and sanitation and all these things. And we're starting to live longer in general, but now we're starting to see life expectancy go back down. And we're seeing new issues with chronic disease that were never there before. So we've gone too far. And now we need to come back and rebalance, and convenience and all these other things is leading to a chronic disease epidemic. And so if we start to be mindful of some of these basic common sense things, like the food that we eat and the toxins that we're exposed to, then we'll decrease our risk. And that's all that we can really hope for, is try to make our kids as resilient and healthy as possible.
Well, and I think about the idea that you have two roles that are supporting your perspectives on all this. One is that you're a pediatrician, but you're also a dad. And if you were to go back to your former self as a new dad, are there any words of wisdom that you would want to give yourself?
Yeah, I think, it's always funny because people, and I put this in the book too, it's like people always think, oh, I'm a pediatrician, it must be easy to be a parent or whatever. And that's not true in any way, right? Being a pediatrician doesn't prepare you to be a parent. I mean, obviously there's some things that are useful in terms of medicine and knowing some stuff, but for the most part, being a parent has nothing to do with pediatrics. It just has to do with figuring out what works the best for your kid and kind of manage things as you go. So I think just like anybody else, I have those new parenting fears and worries. And if I can just go back, it's just a reminder to that I can do it, and that this is something that adults have been doing forever, and we do a good job. It's innate inside of us, and I try to impart that on parents as well in the book too. It's like, you got this, we can do it, and just have that confidence that you will figure it out, and you will know what to do. Nobody knows exactly what to do on day one, and you just figure it out as you go.
Well, that as I was reading that early chapter in your book, it really brought me back to those early days of, I'd been in as an OT for 0 to 3-year-olds for my entire career, and I did feel like a duck out of water, but I did get through. And so, yeah, that resonates with me as well. When it comes to looking at what we are not talking about in general, not you and I today, but in society or in medicine, what are we missing in terms of an important conversation that's going to support families or support child health?
I think the biggest conversations that we're missing. So number one, I think that censorship is really a big issue in health and medicine. I think that there should be open discussions on every single topic, and the best information can kind of be debated back and forth, and that's really helpful. And I have seen over the last few years, some censorship on a variety of different topics when it comes to health especially, and I think that's not the best way to move forward for our health. And I also think, just in a general sense, there's a lot of conversation these days around moving responsibility away from the family, the parent, and the child more towards genetics and society. And it's just like, oh, it's just kind of the way that it is. Oh, it's just normal to have these conditions. And that's not true. Most things have exploded. Most conditions have exploded over the last few decades. And so I think we need to take responsibility back and have more conversations around our own responsibility, society's responsibility, and what's actually happening with, conditions like autism and autoimmune conditions and all sorts of things that we're seeing the numbers explode. And again, not to blame or shame anybody, but to identify that these things are environmental to a certain degree, and we need to figure out what's going on in our environment to cause or contribute to these increases, and then what can we do to make it better. But I feel like I'm seeing more and more of a discussion moving away from personal responsibility, and I think that's frustrating.
I recall a few of your posts on Instagram talking about the personal responsibility piece, especially around one of the foundations that you've talked about today, which is food. That ultimately, despite the overwhelm, despite the worry about doing it right or wrong, as parents, we're the gatekeepers for the food that we're bringing in to our children, we're bringing into our own bodies, and that has a direct impact on overall health. So that's fantastic. I love that perspective. And I think this idea of being able to explore ideas is going to be the best way to be able to support families in getting to optimal health. I know I often talk with my clients about, what did humans need like 100 or 200 or even 500 years ago that is not as available to us right now? Can that be a guide for us in understanding what it is that we need to reduce the disease burden, to lower the risk that our kiddos are going to have autoimmune disease? And it's at a time in family life when they have very young babies where it can be overwhelming. And that's where that idea that you're giving around these little steps to move forward to something positive is exceptionally helpful. We talk a lot about taking the easy versus the thoughtful approach with something like food. And I recall in your book, you were suggesting to parents that there's also an opportunity to not always take the hardest road just because they think it's the right way. I wonder if you can speak to this idea of choosing to go the hard route, whether it's thinking that somehow baby-led weaning is absolutely better than puree and that puree is the lazy way, or that cloth diapers versus disposable, or formula-fed versus breastfeeding. Can you speak to this idea of the hard way is not always the right way, but one of the right ways for families can be the way that works for them?
Yeah, absolutely. So to me, and this goes back even to the title of the book, Parenting at Your Child's Pace, or, parenting at your family's pace, realistically, it's you have to take into account what makes sense for you and your family. And there isn't one way to do anything. There is research and data on lots of topics in parenting. And I try to synthesize that for families that I'm talking in the office or in the book. But at the end of the day, most things, almost everything doesn't have one way. And so you have to figure out what works in your personal situation. And baby-led weaning is a great example, right? There is some data that shows that baby-led weaning might be better in certain indicators, but it also causes a lot of stress for some parents, and there's nothing definitive about needing to do it. And so if you're super stressed at every single meal because you're worried your child's going to choke with baby-led weaning, then maybe that's not the best option for you to start with, because all the anxiety and stress is not going to be good for you or your child, and that's going to be a net negative overall. So maybe you start with purees, and you start with some of the softer foods that are kind of like baby-led weaning, and then you work your way up to full baby-led weaning as they get a little bit older. And I also remind people, well, like, there's some stresses like that like, what's the real stress in the world? Some kids don't have food. So baby-led weaning versus purees, it's not going to be the difference in them getting into college or not. And you asked about formula and breastfeeding. So there are, of course, things in breastfeeding that you just can't mimic in formula, at least not yet, probably never. But, we have this amazing thing called formula that can keep our kids alive if we are not able to breastfeed or choose not to. And that's totally fine. We encourage, I certainly encourage breastfeeding whenever it's possible, but that's not always possible for every family. There are medical reasons why you can't breastfeed. There are personal choices why you choose not to, and that's fine too. So I think, again, it's important to encourage what we know to be the best for our health, but at the same time, for your own family, that might not be best. And there's nothing wrong with doing what makes sense for your family or what works best for your family. Or maybe there are very good reasons why you have to do the thing that would be considered medically not the best, but maybe it is for you. So don't feel bad about it. Just take in the information. And that's how I try to teach parents how to do this, is take in all the information and then synthesize it and do what you think is best based on your gut and based on everything you've read and learned.
One of the examples that you gave in your book was the idea that you pulled in the evidence on for too, was this idea of the baby-friendly hospital. And one of the foundational principles of baby-friendly hospitals is rooming in for the first 23 hours. And yet there's also, when you're in the hospital, it's one of the few times that you have intense amount of support during a very big transition. And you suggested in your book, if you want your baby to stay with you, you certainly encourage that. And there's wonderful opportunities and important opportunities for being physically close to your baby. And yet, if you need that break, being in the hospital and having a nursery and a nurse that could care for your baby while you're just getting that little bit of rest that you need to recover from birth or cesarean section. And yet I think back to me as a young parent and how much I put some of these measures on like a hierarchy of like the optimal, what I was aiming for, and then the judgments start coming in, self-judgment or judgment of others. I wonder if you have any advice as a dad and a physician on buffering the judgment that can happen inadvertently and even with the best of intentions around parent choices and around navigating raising our kiddos.
Yeah, I mean, we all have expectations and what we want, but I think we have to really be mindful to set realistic expectations and also be willing to kind of go with the flow, because one of the most important things with parenting, as any parent who has had kids knows, or as you will find out if you haven't had kids, is not most things don't go as you exactly expected. And so I think it's good to have a general idea or a plan, but you have to work with what makes sense. And you may very well have the plan to room in with your child, and then some medical issue happens, they have to go to the NICU, and you deal with it as it comes. Or you may have every intention to keep your child with you in the room, but then you have a very difficult cesarean section and you just need a little bit of time to heal. And so we have to give ourselves a little bit of room to adjust our expectations or hopes based on what's going to be best for us at that time, or what we decide at that time is the best. And I think it's just giving ourselves that space and the room to make those adjustments, and understand that just because we have a certain plan doesn't mean that it's best at that time for ourself or our child. And that is going to, I think, leave us in a better space than feeling like you failed because I was going to room in and that's what I'm going to do. And then I just couldn't do it. Or I was never going to have a C-section and then I ended up having one. It's like, well, sometimes things happen and then you got to do what's best in the bigger picture. And if we give ourselves that space for that, then I think we're going to be a lot farther along in our mental health. So yeah, I think it's good to do some research. It's good to have a plan of what you might want, but don't be too hard and fast on most things in parenting, because your children will have another plan.
Yeah, they certainly do, don't they? And I think when we look at overall holistic family health, it's about providing what our babies need, but also providing what we need so that we can provide what our babies need. Mm-hmm. I wonder if there's anything that I have not asked you today that you would love to add before we come to a close.
I think I would just love to finish with reminding parents that parents have done this forever, and it's innate in all of us, and nobody feels totally prepared when they go into it, and that's totally fine, but we can do it. And I have seen it over and over again that, a first child, everybody's super worried. They're worried about every little thing. And then the second child, third child, you're like throwing them around and putting on the clothes real fast. And like, you're not worried that they're going to break every time you put on a sweater. And you have a little bit more experience at that point. So, and it's not that you know so much more. It's just you feel a little bit more confident in your abilities. And so I hope that my book and just in general talking can be a reminder that we can do this. You got it. And it's fine to be a little bit nervous, but don't be overly nervous. You don't have to read every single book. You don't have to know every single thing. You figure it out as you go. And that is the best way, I think, to parent, is just figuring out as you go and having some general idea of what to expect.
Lovely. Well, I sure, again, appreciated getting to read an advanced copy of your book. And I think it's a beautiful addition and a much needed addition to the discussion on what happens after we have a baby, right up to the third year. Now, I know the book comes out in August. I expect that we'll be able to find it on the usual channels like Amazon. But where else can people find you?
Yeah, so you can find me on Instagram as the main place, Dr. Joel Gator. And you can find the book, everywhere where books are sold. It's available for pre-order now, and then it launches August 6th, so it's not too long from now. You can go to the website for the book, parentingatyourchildspace.com, and you can grab it from there. If you do grab it from the website, my email is there. You can message me, and I will send you if you message me now, I'll send you the first chapter. I'll send you a bonus chapter and 1 month free access to my VIP community, which is, we have a bunch of parents. We all chat about natural parenting, and parents ask questions, and we do lives and Q&As and all sorts of things. So if you want to dive a little deeper or have specific questions, then that's a great place to, get a little bit more than just reading a book. So you can message me on there for sure.
Wonderful. And I'll include all those links in the show notes. Dr. Warsh, it's been a pleasure to get to talk with you. We covered a huge breadth in a really short time, but I think the perspective that you've given us today is going to be helpful for our listeners. Thank you so much.
Thank you. Thanks for having me on.
thank you for joining me on this episode. I do hope that you found the information and perspectives in this podcast episode helpful to you as you navigate your baby's sleep development. Of course, this podcast provides general information and it isn't tailored to your family's reality or the specific needs of your baby. If you're concerned about your baby's sleep or health, be sure to reach out to your healthcare provider. If you're feeling exhausted and overwhelmed and you need a place to feel nurtured and reassured, you can find me on Instagram at familysleep.ca. Until next episode, look for the connections that support you and your baby.